Well, welcome to PSN Secretariat for today's press conference. According to the program here with me, we like to sing the national anthem. We hail thee, our own dear native land, the tribes and tongues made differ, in brotherhood we stand. Nigeria's God, I'm proud to serve our sovereign motherland. Extra nìyẹn. First, the second stanza is the national prayer. Oh, pharmacy anthem. No. Pharmacy. We were taught a part of the yes, pharmaceutical, pharmacy. We are there. We are there. We are there. We are there. Manufacturing. We are there. Academia. We are there. Just name it. We are there. Thank you. Okay. Welcome remarks by the planning committee chairman.
Good afternoon. Our fellows in the house.
Àwọn fellows mi lọ
I want to just make a small remark that the pharmacy week of this year is a special one. As you can see, we are thinking of how pharmacy is going to have a better future. And we sat down and we thought over it to have the theme of the week, which is a sustainable future of pharmacy. How best it can be achieved, and we look at all the parameters that can make the future of pharmacy practice a sustainable and standing one, even better than the way we are practicing now. And we put it that both pharmacists and other professional team should come together and interact to have a good standing for future pharmacy. And we look at it again that patient orientation. Pharmacy has to do with people who are treating. We want them to have good care. Look at that as one of the parameters that can sustain a good pharmacy, future pharmacy practice. Then we look at it with the current issues in the world, artificial intelligence and telepharmacy. We see that if we can have all these things combined, then we bring the future of pharmacy practice will be much better than we have it today. And as we are going, we have had the first step today, the outreach. Tomorrow, we are going to have the opening ceremony. And at the end of the day, after the whole health license, we know, not that we hope, we know that all pharmacists practicing, we have reasons why we need to do our best to ensure that pharmacy practice gets to bear their whole hope to have it. I say, it's good provider and the heads
correct.
okay in this country. Thank you very much. I want to hope that the week will be a very enjoyable and beautiful one. You are welcome. Thank you very much.
Thank you very much, sir. This pharmacist Ramon Oyewole, the chairman of the conference committee. Thank you very much. In every PSL gathering, we usually give due respect to our elders. And as a result of this, we have a fellow in our midst. Okay, we have two fellows in our midst. And they say we should give honor to whom honor is due. I welcome pharmacist Eso Taiwo, FPSL, all the way from Lagos State. You are welcome, sir. Please elders corner, sir. Of this program. Thank you very much, sir. You are welcome, sir. And he did not show it just by sending something to us. No, he showed it by coming physically. And he will be here with us till Thursday. Thank you very much, sir. We appreciate it. Another fellow in the house is our own dear mommy, the youngest girl in town. Beautiful mama. About I call her Mommy Yokotade Araromi, FPSL. She's a mother indeed. Thank you very much, ma'am, for all your efforts. Thank you. I also recognize. I also recognize the presence of pharmacist Elemide. Oh. You are welcome, sir. He's an elder of the profession. Medical outreach. Okay. And I also recognize the presence of pharmacist Adeleye. I will not forget my indefatigable pharmacist Tunde Laiwola. Oh, okay. I'm told that is the latest allergy in town. It's been so wonderful. I'm impressed. And thank you very much for anchoring the medical outreach. Yeah, you did well. Thank you very much. We appreciate you. So on this note, I I will just go straight to the my address, and so that we can save time. Gentlemen of the press, you are all aware, you are all welcome to today's press conference being held to usher in our pharmacy week as well as the launch of our 550 million naira pharmacy house secretariat. As you are aware, the theme of this year pharmacy week is building a sustainable future for pharmacy practice, how best it can be achieved using intra and interprofessional collaboration, patient-centered care, artificial intelligence, and telepharmacy. Distinguished members of the press, ladies and gentlemen, on behalf of the Pharmaceutical Society of Nigeria, Oyo State Branch, I stand before you today to discuss a matter of paramount importance to the health and well-being of every citizen in our beloved state, and indeed our nation. The future of pharmacy practice in Oyo State is not merely about dispensing medications, it's about optimizing health outcomes, ensuring equitable access to quality healthcare, and safeguard the public trust. To achieve this, we must embrace a sustainable approach that is forward-looking and adaptable to the evolving landscape of healthcare. Definitely, you know that our theme stands on a tripod. I will take the first tripod, and that's the power of intra and interprofessional collaboration. Our first pillar above is the bedrock upon which a truly sustainable healthcare system is built. Within the pharmaceutical profession, we must foster greater collaboration among pharmacists in various practices, such as community, industrial, hospital, and academic. We should share knowledge, best practices, and resources which will elevate the standard of care across board. This includes leveraging the diverse expertise within our own ranks to address public health challenges more effectively, such as medication therapy management and pharmaceutical compounding. Beyond our own profession, effective interprofessional collaboration with physicians, nurses, laboratory scientists, and other healthcare providers is non-negotiable. We must move beyond historical silos and embrace a team-based approach to patient care. Pharmacists are medication experts, and our input is vital at every stage of a patient's journey, from diagnosis to treatment and follow-up. Through joint trainings, programs, shared patients care protocols, and open lines of communication, we can ensure seamless transition of care, minimize medication errors, and ultimately improve patient safety and outcomes. The PSL Oyo State Branch is committed to leading initiatives that promote this integrated approach. working closely with other professional bodies and the Oyo State Ministry of Health. Our second pillar is as stated above, that is prioritizing patient-centered care. The heart of all our efforts must be patients. This means moving away from a transactional model of care to one that empowers patients, respects their preferences, and involves them actively in their healthcare decisions. For pharmacists in Oyo State, this translates to enhanced patient counseling, comprehensive medication reviews, and the provision of personalized pharmaceutical care. We must ensure that every patient understands their medications, how to use them correctly, potential side effects, and the importance of adherence. This proactive measure also builds trust, strengthens the pharmacist-patient relationship, and elevates the perceived value of pharmacist services. The third, of the tripod is artificial intelligence and telepharmacy. To truly build a sustainable future, we must strategically leverage artificial intelligence and telepharmacy. These technologies are not luxuries, but necessities in our quest for accessible, efficient, and high-quality pharmaceutical care. Artificial intelligence offers immense potential. AI-powered tools can assist in drug discovery, optimize medication dosages, predict adverse drug reactions, and identify at-risk patients. For example, AI algorithms can analyze vast data set of patient information to personalize drug regimen, leading to more effective and safer treatments. In inventory management, AI can predict demand, minimize waste, and optimize stock levels, ensuring the availability of essential medicines across the states, also the country. Furthermore, AI can streamline administrative tasks, freeing up pharmacists to focus more on direct patient care. Telepharmacy, on the other hand, can particularly relevant in a state with diverse geographical challenges like Oyo State. It can revolutionize access to pharmaceutical services through telepharmacy. Patients in a remote or underserved area can consult with pharmacists, receive medication, counseling, and even have prescriptions validated and delivered. This bridges the gap in healthcare access, reduces the burden on physical pharmacies, and ensures that everyone, regardless of their location, can benefit from expert pharmaceutical advice. Telepharmacy can also facilitate medication adherence, monitoring through remote follow-ups, and provide specialized consultations, enhancing continuity of care. To achieve this, we need to invest in the necessary infrastructure, develop robust regulatory frameworks and legislative process for telepharmacy and AI. AI in healthcare and provide comprehensive training for pharmacists to effectively utilize these technologies. This includes digital literacy programs and specialized courses in pharmaceutical informatics. Our proposed pharmacy house secretariat will feature a state-of-the-art training facility equipped to deliver these essential programs and to serve as a hub for research and development in pharmaceutical technology. The launching of the 550 million pharmacy house secretariat, ladies and gentlemen, it is with immense pride that I announce the official launching of our proposed 550 million pharmacy house secretariat, This magnificent edifice will be more than just a building. It will be a tangible symbol of our collective commitment to advancing pharmacy practice in Oyo State. This secretariat will represent a significant investment in our future. It will serve as a, a central administrative hub for all technical and interest groups of the Pharmaceutical Society of Nigeria, Oyo State Chapter. B, a state-of-the-art training and conference center where pharmacists can acquire new skills, engage in continued professional development. C, a resource center for pharmacists and the public, providing access to essential information guidelines and patient education materials. D, a beacon of professional excellence, symbolizing the growing influence and importance of pharmacy in Oyo State healthcare landscape. This project is being funded through the unwavering support of our members, partners, and benefactors, which underscores our collective determination to elevate pharmacy practice to new heights. It provides the physical infrastructure necessary to facilitate the intra and interprofessional collaboration with champion to drive patient-centered initiatives and to accelerate the adoption of cutting-edge technologies like AI and telepharmacy. In conclusion, building a sustainable future for pharmacy practice in Oyo State is not merely an aspiration, it is imperative. It requires a collective commitment from every stakeholders, pharmacists, other healthcare professionals, policymakers, legislators, educators, and the public by embracing strong intra and interprofessional collaboration, a steadfast focus on patient-centered care, strategic adoption of artificial intelligence and telepharmacy, and leveraging the incredible potential of our new pharmacy house secretariat. We can transform pharmacy practice in Oyo State, making it more resilient, more responsive, and more impactful in improving the health and well-being of the people of Oyo State. Let us work together to build a future where everyone in Oyo State has access to the highest quality of pharmaceutical care, contributing to a healthier and more prosperous Oyo State. Thank you. I am now open for your questions. So,
good afternoon, everybody. I think our chairman deserves another round of applause. As a matter of fact, I'm not expecting anything less from him because there was a day I was helping him to write to type his CV, and I called him. I mean, in the middle of the day, I got him a quick away to you. So please help me clap for him again. You know that all our invited guests are not here for tomorrow's program. I would have said that we've had the full exposition of the theme of our conference. So thank you so much, sir. And God will continue to increase you. Yes, because of the quest for time, I will only allow 2-3 questions or comments so that we can leave in good time.
One.
Based on the theme of your celebration. And it's going to be based on the theme of your building a sustainable future for pharmacy practice and how best it can be achieved. So my question is this: we are talking AI, we are talking about access to medicines, we are talking to affordability of medicines. And not too long ago, Lagos State people, I mean, here in Lagos State, came to talk about the extent of fake drugs in Nigeria. I want to now ask, how, to what extent can AI help us to reduce taking of drugs, improving access for every drug in Nigeria to drugs, effective and safe drugs? Thank you.
Solutions and your 3.9 FM Ibadan. So I would like to ask, what is your branch or your association doing in, ending quackery in your profession? Because we have those that will say alakapo, and for those who also who are not really in this profession, what are those measures you're putting in place to stop this quackery act in your industry? Thank you.
My name is Olaide Abiy from Christopher 91.1 Ibadan. My question is talking about accessibility to quality drugs. What is PSN doing in making sure that quality drugs gets to the grassroots, especially people in Okeomo, Ibaraba, have access to pharmacy? I know you have a branch, community pharmacies, but when you get to these areas, you discover that there is still a menace of adulterated drugs, fake drugs in those areas. So what are you doing in ensuring that professionals in your profession are doing the right thing and are ensuring that people have access to quality drugs in those areas? Thank you.
I think my colleagues asked a similar question, but I want to break it down a bit. Pharmacy. I will not do so-called chemists. I will not do so roadside doctors. I don't know what they call them. Okay, patent. That's what we call them. We call them chemists. So, what is the difference between the chemists, pharmacy, and those road vendors, and which one can you recommend for us most and why?
So you have to.
Thank you.
Okay. Stop. Let me answer the first one. That is talking about AI in the use of AI in reduction of fake and counterfeit drugs and improving access. Okay. AI may not improve access because it's an information system, but telepharmacy. That's so. If you read my paper, you will see that I emphasize more on telepharmacy as a tool use of increasing access. And what do I mean by that? You can with telepharmacy, you can have a discussion with your patient that is in a remote area. As long as that individual has, a smartphone, and you can do your consultation, and you can actually tell, you can assess that patient, and you, from there, you can take your decision as a head giver. Either you now send the drugs, through, you can send the drugs, via, courier service. So that ordinarily, that patient may not have that opportunity to receive, soil because the patient may not even know what is, may not have access to either any health care provider. But the use of the smartphone has brought down to, various, so you can discuss with that individual and, assess him or her. AI is an information system. It's not, AI cannot do everything. We should not expect AI to do everything for us. But it can only help us, it can only assist, in achieving the, what we actually want. So AI is only helping us. It's not that it will take our role as, pharmacists. So I just want to make that clarification. On the issue of quackery, the SCPL chairman is here. So let's hear from the horse. I'm not calling him a horse, but I'm saying let's hear from the horse's mouth.
Thank you, Mr. Chairman. Ending quackery in Oyo State is very possible, but as let me try and explain what you are saying, quackery. That's when we are talking about people that are not licensed to carry drugs, they hawk drugs and they take drugs all around in where drugs are things that has storage conditions. You see them selling drugs around the marketplace in unregistered areas. Factory can be stopped if we have collaboration with other agencies. Pharmacists alone cannot stop quackery in Oyo State, but we have been doing advocacy visits to NAFDAC, to the PCN, and to Oyo State. That's what we have done to see how we can stop and reduce quackery in Oyo State by going to see the Commissioner of Health. We have done that. Together, our chairman was there. We spoke with the Commissioner of Health. We did that late last year, where we spoke to her about setting up of a task force to help eradicate or reduce quackery in Oyo State. When you want to reduce quackery, we need security agents, we need everybody on board. It's a collaborative exercise. And the only way we can do it is when all agencies involved in drug regulations are involved. And that is why the state must be there, the NAFDAC must be there, the PCN must be there, the NDLA must also be there. And the state must also have a strong political will to carry up this exercise. That's why I said that we have been doing advocacy visits, because we cannot do it on our own. We don't have the political power to stop quackery, but we can help in letting those that are in power understand the effect of quackery on the community or Oyo State in general. And we know because of quackery, we've started having serious drug failures. The outcome of failures of drug due to drug resistance has increased because people are storing drugs with wrong temperatures, they are storing drugs in wrong places, and also controlled drugs are getting into the hands of the wrong people, which is also a security concern. Drugs like tramadol, criminals can have access to it, and when they have access to it, they can do and undo. And that is why we have continued our advocacy to all the agencies and the state government on this to ensure that quackery is ended. And I know in the nearest future, before the end of this year, we are getting there. And as you said, we cannot do it, but we can only do it as a collaboration with all other agencies. And already we have started doing that, and we will surely get there. Secondly, you asked a question: what's the difference between a pharmacy and a chemist? You see, if you look at the history of pharmacies, pharmacy was first called chemist before it changed to pharmacy. It was the history. We were first apprentice, from apprentice to druggist, and from chemist, druggist to chemist, from chemist they are now called pharmacy. And what you mean is that patent medicines. A pharmacy is a registered place where drugs can be stored, sold, compounded, and even counseling is done. That is what you call a pharmacy. A pharmacy is where you go to and you can be counseled on your drug, you can be talked about the use of the drug. The drug is well stored. The professional, the pharmacist is the professional that is in charge of a drug. There's nothing you want as far as drug is concerned. You go to meet a pharmacist. He's registered. He went to school for 4 years, 5 years. It's now 6 years. Pharmacy is now doctor in pharmacy, we call PharmD. Most of the universities are going into PharmD because pharmacy is going more into clinicals, more into services. And the other part is, and let me put it, pharmacies sell OTCs and prescription drugs. A pharmacy where you can get OTC, OTC is called over-the-counter drugs. The POM is only prescription drug. But the patent medicine is a place, let me give you the history of patent medicines. We found out like 10, 15 years ago that pharmacies are limited. We have very few pharmacists in Nigeria, and we have a lot of people to be serviced. So we find out that pharmacies are not in the hinterlands, that means in the local areas. So they allow people that can read and write to store OTCs, that's over-the-counter drugs like paracetamol and the rest, and they will be trained. Those people are called patent medicine vendors. They are trained by the PCN. So those are the ones that is called, they are to store only OTCs, over-the-counter drugs. But you know, Nigeria, they've taken it far that some of them are trying to do what the professionals do. So when you want to see, what's the major difference? When you see a pharmacy, you see the cross. The green cross signifies that you are in a pharmacy, one. Number two, when you enter into a pharmacy, you see the pharmacy certificate. It's always there. We have the pharmacy, we have two kinds of certificates for a pharmacist. We have the annual license registration and the annual premise registration. He always puts it for people to see. That's the major difference. And please, when we get into any place, always ask, please, can I see the pharmacist? Because that is where you can get genuine information about your drugs. That is where you are sure that any drug that you are buying is original. Because all drugs are poisons. That is why drugs are prescribed. That is why drugs are dosed. Because if you take more than the prescribed dose, you can lead to death or damage of organs. That is why we have to be very careful where we go and get or source our drugs. We should go, especially our prescription medicines, should be bought in pharmacies. As I said, that's the major difference between a pharmacy and a patent. Thank you very much.
Thank you.
Okay, additional. Thank you, sir. Very brief, sir.
In addition to the first question that Chairman answered, I want to say that the collaboration in combating and counterfeit, there's nothing we do that can actually be made known to the society if the press doesn't take it out for us. That's why I want to say that we need press so much in fighting this battle. And the press need to be also more enlightened about this profession. I've seen situations when people from the press are talking about healthcare professionals. Most times they talk about doctors and pharmacists. It's a common thing. You even see people who are in government, they talk about healthcare professionals. They say doctors and doctors and nurses, rather, doctors and nurses. And I begin to wonder, this thing is not complete. The healthcare practice is not only about doctors and nurses. There are other players in this group. And so that's why press need to be more enlightened about this profession. Because there's no way we talk about drugs and we don't talk about the experts, the professionals that are like to handle the drugs. And so if those professionals are left out, then the drugs, that means anybody can do anything with the drugs. That's what I want to say. That's the addition I want to make. Thank you very much.
I think let me answer the last question. We talked about how we get quality drugs with the grassroots. You see, quality drugs per se is a function of what we call good manufacturing project and good distribution project. From the manufacturer, if the products are not quality from the manufacturers or the importers, already the problem to anywhere it goes is already there. So the first thing we have to enjoy is that we know that the drugs are from the quality source. That's the first thing. Because you cannot take all the drugs you want to use into laboratory and test whether it is original or fake. Even nowadays, there's so much clone. The fake one, they look more aesthetically than the original. They are confused. Even we pharmacists, we are confused. But genuinely, if we take it, we have the products from the source, real source, we are sure of the quality to start with. Then, how does it reach the far local areas? That's where the question is. If you look at it, from 10 years ago, pharmacists, they were not interested in going to rural areas. That what led to better medicine, association and everything. Nowadays, we have been advocating it, and it has gone far. Somebody was mentioned Secretary Oyo and Co. I'm glad to tell you that Oyo, there's a pharmacist there. There's a pharmacist there. All those places, we have pharmacists there. And they have been trained, informed that they should take their products from registered places where quality are entrenched. If a pharmacist goes to open place and take a fake drug, it's part of them. Here in Oyo State, thank God, we are blessed now. No pharmacist will tell you that he or she doesn't know where to take policy drugs. Because drugs are too many. And you can't test everything, as I said, in laboratory before you start using them or giving them to people. So now, we are doing it as pharmacists. We are taking our products from good sources and we are taking them to fair people, and we are advocating that all people should patronize the pharmacies where pharmacists are working. Do you get my point? It's the first line that we can attract fake drugs and make sure that it reaches the far end. And more importantly, the PCN is doing wonderfully well now. They are now telling all these better medicine dealers who are helping us to do some field distributions to ensure that they take these products from registered, qualified, assured points where quality ones are being made. And they are really teleguiding them, watching them and checking them. Although manpower nowadays, when it comes to regulatory, they are not enough. But we, people in the practice, we have come out to support them. And we are visiting these people to ensure that they don't harbor fake drugs. And if you look at it holistically, again, NAFDAC and other agencies, they are helping. Mind you, all over the world, eliminating fake drugs is a big threat. All over the world, not only in Nigeria, all over the world. I watched one documentary from Korea or whatever, where they were manufacturing drugs in open place in the corridor. And those things are being circulated all over the world. That's why I said, having to know the source of the drug is the first area to curb fake drugs spread to anywhere. And I think in Nigeria, in Oyo State in particular, we are trying about that. We hope that God will assist us to achieve what we plan for. Thank you.
And well, I'm sure you are aware of the NAFDAC project of traceability, where you follow the drug right from the manufacturer up to the consumer. So that project is on. So these are measures that are put in place to be able to, curb the menace of fake drugs and unwholesome drugs. So there are a lot of things being done. It may not, it may not be feasible to the, to the general populace, but with time, this will get to, or we know within the system that a lot is being done, to curb this. And let me also inform you here that the issue of fake drugs worldwide is a multi-billion-dollar investment for some people. They spend a lot of money. They spend a lot of money to, to get these fake drugs, to do fake drugs. Multi-billion dollar. In fact, the underworld, that is their this thing. The issue of fake drug. It's something that is a worldwide phenomenon. It's something that is very, very unfortunate that human beings, we have to do this to ourselves. You know that this thing will injure your neighbor, and yet you will put in money into it to ensure that you bring them just for profit purpose. I thought it was only in Nigeria until, in South Korea, it's a big business. It's like, even the cocaine drug menace is little compared to this issue of fake drugs that we're talking about. And some countries are known for this. That is all what they do. So it's left to us as a people to decide, what do we really want for ourselves? Government's policy, they are there. But the body language of the government itself on curbing this is something else. You want me to go and stake my life to, to curb this? These people are rich and they know it. And you will not provide adequate security for this. And then you want me to go and enforce. Have you heard? I was a task force chairman in this Oyo State, 1995, 96, 97, 98. In this Oyo State, we were almost killed by gangs of people. We were almost killed. We were ambushed on our way going to, to seize fake drugs. Thank God that I'm still alive for me to sit down here and talk to you. So it's not, no, it's something that I'm passionate about. The body language of the government itself is not like it matters. I must tell you that. So there is little you and me can do. We will do our best. But I can tell you that as you are trying to do this, they have 1,001 ways that they were coming out. So I will stop at that. But I can tell you that one day we shall overcome in this battle. You can, but that will be. No, you can, but there is no. Okay.
In terms of access, from 1 to 10, where do we stand? Access to drugs in Nigeria. That's all I want to use as a follow-up.
As a percentage, he's talking as a percentage. Access.
Access
Yes, access to good quality.
For free that we give ourselves a pass mark. A good pass mark. I can tell you minimum of 7/10.
Yep, I think that's
But the chairman has hit nail on the head. Fighting fake drugs or quackery, not what pharmacists people can do. We need everybody
on board.
including the media,
Not only that.
including the media houses. Don't only showcase entertainment. Invite professionals. Let them come and enlighten the people on your programs. I understand you are business people too. You must break through. But pharmacists and other healthcare professionals, they don't sell their services. We are giving information. So anytime we come to your stations for enlightenment programs, smile at us. Smile at us. That is true. Thank you. The only assignment I have is to give vote of thanks. Yes. On behalf of the chairman and the State Executive Council, I want to appreciate everybody for coming, especially our fellows in the house and the elders of the profession. And just we've said as part of our team for the conference, it is a collaboration. So I want to thank everybody, also the media people, for coming to celebrate us and rejoice with us on the occasion of the Pharmacy Week. The Pharmacy Week just started, just finished health outreach at the Palace of Odobadan. Tomorrow is the conference opening proper at MOV 21 Event Center. So I will crave the indulgence of everybody, including our media friends, to join us. And on Thursday, we're having the launching of our pharmacy house complex. The pharmacy house is located at State Hospital Road, along Adeyo State Hospital Road, adjacent to Ilade Babu Walk. But I can assure you, by the time we are done with the pharmacy house, we won't need to be describing the pharmacy house as adjacent to Ilade Babu Walk. It will be on its own, self-speaking, Oyo State Pharmacy House Secretariat Complex. Thank you for coming, and I pray that God will take us back to our destination safely.